So, King's College London, guys, is one of the most prestigious universities around the world when it comes to studying dentistry and learning everything that is preclinically and clinically. I'm quite fortunate that my guest today is somebody who is a current student at the university and is about to enter his second year. A lot of people are actually trying to understand what UK universities are like. And more importantly, there's so many students that are about to step foot into KCL but have no idea what's to come in their first year. So I'm quite happy to introduce you guys to the man himself. If you'd like to take it away, introduce yourself and give us a bit more of a background. And then we'll get into the nitty gritty because I'm sure there's so many people out there that want to know more about KCL and your journey.
Well, first of all, thank you very much, Naveed, for that introduction. Nice big introduction. I'm not sure I'm worth all of that just yet, but thank you so much. Yes, so my name is Nikhil. Like you said, I'm a second year dental student at King's, about to go into my second year. And yeah, I'm looking forward to this podcast to share some of my experiences of first year. Hope to see what is on the future for me, give some other people some insight about first year, dental school, application, the UK, whatever I can.
Perfect, great stuff. That's what we like to hear. And of course, so Nicola and I had a conversation before this, going back a couple of weeks now, and we were discussing kind of what his journey into university has been, how it's probably been a little bit different to what he was expecting when he kind of stepped foot into it, because he's actually not from London. So KCL is based in London, and he's actually not from there. So a lot of people do ask, what's it like to go somewhere further from home, stepping away? It's the first time for many students to actually be away from home long term. So let's kind of dive into that initially. What was that like? Like, where are you from geographically speaking, so people get an understanding? And then what was that mentality shift like to say, right, I'm moving out of the house, away from my parents, my family, my creature comforts, and I know that I've got to do this independently. So give us a bit of a background on that.
Yeah, so I'm from Lancaster. It's a city in the northwest of England. Not too many people have heard of it, but it's around an hour-ish away from Manchester, so quite far north, and around 250 miles away from London. So my way down is a 2.5-hour train, and it's quite expensive train. But yeah, I am quite far away from home, living in university in London all by myself. And at first that was quite a big change, to be honest. I'm from a little city, going to big old London. It was a big shock, but I think one thing my dad said at the very start, and his dad told him that, is that for university, just live out. Even if I got a university that was close to home, living out, because one thing with that is you learn so many skills. I know loads of people think different things, have different situations, but I do strongly believe that living out teaches you so many more skills or than you would have got in university if you didn't live out. So I lived in Great Dover Street accommodation. Most people who went to King's will know that accommodation. It's right beside the Shard. It's where all the medics, dentists, healthcare students tend to be during the first year.
Nice.
It houses around 800 students.
Okay.
It's quite a lot of students, and the rooms are a box. I'll be honest, they are a box. Tiny single bed, tiny ensuite, which is pretty much a wet room the size of a cupboard. And
that sounds like any London apartment at this rate.
Any London apartment, yeah. And I told some of my other friends from London how much I'm paying for that, and they said that was a bargain. But I told my friends outside of London how much I'm paying. They said I'm getting ripped off. So
okay, so for the sake of the students, right? How much were you paying at when you went
in the 23-24 academic year? It was 215 £215 a week.
Oh, okay.
A week, yeah.
Shows how out of touch I am with the UK. I've been away for so long.
And I know this year it's gone up to 226 per week. So just that 1 year, £10 more per week, which can add up over the course of the year.
Okay, yeah. So to give some perspective, that's very close to what I'm paying right now in Slovakia per month. Right? Close to. It's a bit cheaper where you are per week, right? But if you were to scale that up per month, that's ridiculous. The fact that you guys are paying essentially 4 times more than maybe some places in Europe, but that's London for you, right?
That is London. Yeah.
So just something for students to note that if they are moving out, to be prepared, whether that's from student financing or bursary or from their own pockets or from their family's pockets, just be aware it's not cheap around the KCL area. And obviously you mentioned there that there's some skills you needed to pick up. Living out your dad's advice, which is great advice. And I pay homage to that because I feel when we do step out into the world, that's when we mature as individuals, as men and women.
Yeah.
What kind of skills have you picked up within your first year at university?
Yeah, so it was a big culture shock living at home in a small city to now big city London, and now I'm by myself. And I think being by myself is where the big main skills have come from. Even simple things like every day in the morning, I needed to eat some food, some breakfast. I needed to get up and make that myself, waking up myself, making sure you have a routine. I think that's one thing that I learned the most in first year, being able
Mm,
to have some sort of routine. I say this many days I didn't have any routine. I slept so late. I woke up so late. I didn't eat this. I didn't eat that. Whatever. But when you get into some sort of routine, that's when you feel like you're feeling more productive every day. You're feeling healthier. If you go on a run and you make that some part of your daily schedule, you're feeling like you're able to work. And the workload, I'm sure we'll touch on this somewhat later, but the workload isn't easy in university.
mm,
And having to balance that with everything else you're doing, extracurriculars, going to need to make friends for yourself because you're in a whole new place. You're not necessarily going to be with your cocoon or your bubble from home. So living in London, living far away from my home, my family, that's definitely taught me a lot of skills.
mm.
Equally as much as university's taught me, living out has taught me the same number of skills. So one thing that I would like to advise and I'd like to tell people that haven't lived out before and that are potentially going to university in the next year, next few years, is when you live out, you learn things like how to manage yourself, how to not have a dependency on someone else,
Yeah.
being a bit more self-sufficient, and it kind of takes away that cocoon that you've had at home because at home you've had your parents a lot of the time, you've had friends that you've known for many years. In university you may not have all of that and you're going to have to
Mm.
do things yourself, so even simple things like setting an alarm and making sure you wake up. I know even at home I set an alarm around 90% of the time I wake up. The other 10% my parents do come and save me.
You're damn right. Yeah.
University, you need to wake up yourself, especially if you've got something clinically in person that day. You need to wake up. You need to have food for yourself to be able to survive. You need to be able to make your bed, everything. You just learn how to do things yourself, which sets you up for life.
Yeah.
When you after university, you would have graduated, potentially be living out somewhere there. Even more skills you learn there. Even just anything like that, it genuinely does help when you
I
learn.
think we do get into this like almost comfort zone, right? Where when we're around family and
Mm,
some people might be sitting there listening to us going, your parents did your bed for you and they made your breakfast for you. Like, we never had that. Fair play, right? But some people do have that almost, as you kind of rightly called it,
mhm.
like a cocoon, like a bubble, where everything is almost perfect. You
Yeah.
you know who you're meeting on a daily basis. You've got your friend circle. Your family looks after you. You're never thinking, "Am I going to go hungry today?" Right? You're
Mm,
never thinking, "I'm going to miss that appointment." Then all of a sudden, it's like a flick of a switch, and all the responsibility lies on you.
yeah.
I think it is something that you only actually realize when you're there and you're doing it. So that
Mm,
must have come as a bit of a shock to you. How
yes.
did you overcome that and ensure that you weren't failing on this? Because I see a lot of students, even going back to my time at Brunel University years ago, that actually left living on campus to return home because they just couldn't
Mhm.
handle that culture shock. So
Yeah.
how did you overcome it?
Mhm. That's a good question because some of my friends as well, in first year they lived out, but second year they're going to live back at home. Some is very different reasons. Some they would have loved to live out, it's just other reasons they can't live out. But me personally, I have no choice living so far away from home. I need to be able to live out, and for that reason, I did kind of structure my thinking in first year to be able to allow for that. So one thing I highly recommend is making a good network of friends or people in university to have around you. At home, you have your family and your home friends and whoever else may be there. At university, you're by yourself at the start, but because you're by yourself at the start, it does not mean you have to be by yourself at the end of first year, end of first term, end of first month, even.
Yep.
Making those, having a nice, tight knitted group where you can just go and sit and have a chat or you can chill, make some food together. Having that is I highly recommend that to new students, and it doesn't come easy. I know for me personally, it took quite a long time to find my right group. During freshers, I spoke to loads of different people. Some people it clicked, some people didn't. But just getting yourself out there a little bit, meeting new people, saying yes to new opportunities, that is one thing that can help you live out and be comfortable living out
Yeah.
for however
Yeah.
many years you need to.
For sure. I think, I would echo that advice. I think one thing that I always say to people when they're considering going out, because so many people do get in touch and they're saying, I want to study abroad, for example, which is obviously a bigger
Mhm.
step,
Yeah.
but it's kind of the same mentality. It's like, oh, I'm so used to being at home. How do I overcome that? That advice that you put there is bang on. You really do have to put yourself out there. And one
Yeah.
thing I remember doing when I first went to my uni, just, donkeys years ago, was I kind of said to myself, cut the old like nav that you were. Like, no one knows of that
Mhm.
existence of that
Mhm.
person, right? So forget that. Start fresh. Be the person you've always wanted to be.
Yes.
Be expressive. Enjoy the company of others. Speak to every single person that you can, and no one's going to judge you because everyone's in the same boat.
Yeah.
Everyone, as much as you might think that you're a bit awkward because you're approaching someone randomly, they're kind of begging that you're approaching them, right? Because they're in the same. They're scared themselves. Everyone in the first year is kind of all sat there like shrinking away, going, I hope someone approaches me. So if you can take that first step, not only do you break that barrier down, but then you start forming really good relationships with people. And I really like the point that you made there, that really try to get to know everyone, and eventually you'll find your tight
Yeah.
network of good friends around you. So great advice, Nick. I really appreciate that, mate. Let's get into kind of the uni side of things. So first year, KCL, big boy uni, everyone knows it, right? What's it like? Did it meet expectations? Was it over? Was it under? And how did you manage it to now successfully get into second year?
Mhm. Yeah. So first year KCL, a lot of fun. I'll start by saying it was a lot of fun. I enjoyed my first year in uni, met loads of great people, and just experienced loads of new things in life. So that was amazing. In terms of I'll start in terms of the uni course itself, that aspect of things.
Yep.
So first term, we had quite a few in-person events. So I know because of COVID, in previous years, literally from the year before mine until whenever, they had nothing in person at all
Right.
because there was the COVID restrictions. They didn't know what's going to happen in the near future,
Yeah.
just to be safe. But my years when they started to introduce more in-person things, and I definitely think that was an amazing move because linking back to my last point, it allowed you to meet people. I was
Yeah.
just more than the learning itself, it allowed you to meet people, and in first year that's equally important. The years above me, they were saying they had nothing in person. They didn't even know their cohort until second year.
Wow.
So we actually got to know some people, and the future years will have in-person events. So make the most of them. Go in, just meet your classmates, and
Yep.
just get to know whoever, and just experience what being at university is like. Because the previous years they had everything online. So yeah, we do have some online lectures still. So some lectures are pre-recorded from before, some are live
Mhm.
online lectures. They have a
Mhm.
nice little mix, and it's nice so you can plan your life around university as well,
Right.
and university around your life. So say one day you have something that you need to do, but you have online lectures, it's okay. You can watch it another time and you can go out and enjoy London, do what you need to do. It's
Nice.
nice. It's good to have a
Love it.
balance of that. Um, so the first term, first year, there's a lot of tutorials, online lectures, dissection. We do full body
Oh,
dissection in first year in King's
wow.
dentistry,
Getting
which
right into it.
not many universities offer that for dentistry, which is quite nice. It allows you to actually understand what anatomy you're learning. If you learn
Mm.
all the anatomy for that, especially, it genuinely is really helpful. Um, and yeah, the first year it eases you into it. It is quite a big jump from school. I will not take that away. You don't have that support as such in a small classroom because it's
Yeah.
a cohort of around 150 to 180 students, the
Whoa.
biggest
Okay.
dental cohort in the UK.
Wow.
Um, so it's not as tight knit, but you do have tutorials. So if you ever need some support a bit closer, you have that. Um, Jumping to second year now, again, anatomy, a bit more head and neck focus. So
Mhm.
first term was about the whole body you're learning. Second term, head and neck, and third term is pretty much exam term. We finished quite early in first year, so had a nice 3 month long summer.
Nice. Nice. Perfect. And like, did you feel within that there was anything that was kind of too difficult that you had to put a lot of effort into or
Mhm.
adjust the way that you would prepare for things that's kind of now maybe helped you in your journey? Or was it quite plain sailing for you?
Yeah, so this is one thing that I like to definitely want to tell any new student going into university, especially King's. Or yeah, I think just university in general, to be honest. The learning there it's so different from in school. We in King's have lectures, and it's a lecturer talking to you for 40 minutes or so. In that 40 minutes, especially the pre-recorded lectures, you can't exactly ask questions, stick your hand up.
Right.
You don't have like a workbook as such that you can use like you would have in school. It's down to you to learn to understand that.
Hmm.
You can ask the lecturers questions, you can email them later on, they're completely fine, they love that, and they actually reply quite quickly. But being able to learn from lectures was a massive jump for me, and it'll be a massive jump for anyone just learning from a classroom. For me personally, I felt watching the lecture and making Ankis, so flashcards,
Yeah,
worked
yeah.
best for me. I think Anki is a great tool for many students. I'm not sure if you use it yourself.
It's so old. We've been using it for ages, man.
Yeah, but it's great. Years above do help you as well in Kings. So years above do send their notes to you.
Nice.
If you have any questions, they're amazing, great people to go to. But just the learning style, I think, is the biggest jump. If you put your head down and put the hours in, the content itself isn't too hard as such, but you need to put the hours in and put that time in to be able to understand and pass the exams.
So how many hours a week do you reckon you're studying? I mean, there's kind of pre-exam period, which is a
Yeah,
bit more chill, but you still have to stay on top of it because obviously if you don't, you're just playing catch up.
yeah,
So there's two periods of time that I always kind of look at university as, which is kind of the pre-exam period where you're just relaxing, and then it's the exam period, right? Which
mhm,
things double and triple in
yeah,
workload. So there are many students out there that can sometimes feel in that pre-exam period, "Oh, I'll just manage it. I'll catch that up. I'll do that a bit later." That's a really
yeah,
bad habit to get into,
yeah.
right? Now, during your pre-exam period, what was your typical schedule like? How did you manage your workload? And then how did that pay dividends when it got into the exam period? And then how did your exam period revision step up?
Yes, yeah. So I completely agree with you. There's two completely different times in university. Around a month before the exam, the amount of work you're doing is 4 times, 5 times more than what you've been doing before.
Yes.
Yeah, I won't lie. And I think it's a very common thing in university to fall behind and then catch up.
Mm.
But you do, like you said, need to stay on top of your work, because if you do no lectures before, it's not possible to catch up in that last time. So you just have to keep slowly chipping away at it. I'd say I did around 6, 7 hours a week
Okay.
before in like the pre-exam period, which I'll be honest, for the amount of lectures we had, it was not a lot. But again, the catch-up period, and I gave myself a good amount of time during the exam period, like you said, to be able to catch up. And I think
Yeah.
the one good thing about being in university and being in dentistry, or courses that we're in, is that you're surrounded by a lot of similar people. In
Yes.
school, you have a wide range of people wanting to do a broad range of things, which is great. You can get to know loads of people there. But when it comes to being as academically driven, dental students do tend to be quite academically driven.
Yeah. Yeah.
And that whole month or month and a half before our exam, all of our friends, everyone was like a little bit behind. We all wanted to learn together, build each other up, share our knowledge with each other. And that's one great thing about university and getting to know your cohort, is that you're
Mm.
able to actually do that, and you learn more from learning what they have maybe watched in the lecture that you've missed.
Yeah.
So I think that community is really nice.
I think communication is so important. I think when again you're coming up with some golden nuggets of information, and I'm loving it because I can actually resonate with a lot of that. I do feel as though when I sit down with friends and I say, "Oh, this and this and this about one of the subjects that we're discussing," the way that other people interpret information, and then
Yeah.
during discussion you learn so much. So having friends, or even if you want to call them peers and colleagues or classmates, whatever it might be, if you don't want to call them mates, for example, still having that communication is so essential because you will learn things that you definitely did not pick up because
Mhm.
nobody sits there and learns everything 100%. It's impossible, right?
Yes.
And especially as a student, you're not going to understand certain nuances that maybe come up with dental terminology. Having people around you that are equally as driven, that speak
Mhm.
the language of dentistry, and then as you're discussing things, you start picking up different things. You're all
Yeah.
going to benefit, and it's almost like when you teach things to other people, it sits in your head a bit better, and then
Yes.
you can apply that to your exam. So great advice there. I think we should always surround ourselves with the right people,
Mhm.
and then discuss everything that we've done. And I think another thing that you said there, 7 to 8 hours a week, that really translates to an hour a day. So for anybody wondering, it's doable. It's doable. If you can kind of give yourself an hour in the day after university or in between lectures, if you're
Mhm.
on site at a campus or whatever, you can just hit the library for an hour or half an hour there, half an hour there. You can get through that.
Yeah.
It's just a good kind of habit to have, right? But then
Yeah.
as soon as you get into that exam period, as long as you're not catching up, what are your hours looking like per week then?
Um, at the start of exam period, when I'll be honest, I was catching up.
Yeah.
I just wanted to get through the lectures as quickly as I could to be able to study. And during that studying period, then I'd say around 4, 5 hours a day.
Okay.
Yes, 4 or 5 hours a day. So most of my day was in the library.
Mhm.
Some days I did half a day, some days it was a full day. But one thing, I took quite a lot of breaks in the middle just to be able to clear my mind and just get out into fresh air, eat some food, talk to friends, just so you're not solely studying. Because if you're solely studying, you end up passively doing it. I
Yeah.
felt if I sat somewhere for example, 2 hours, at the end of that 2 hours, I just needed some sort of break, or else I
Mm.
was passively doing the Ankies, nothing was going in, I'm not learning anything. So this again comes back to having that nice group of people that you can learn together, you can have that nice break together, you can come back and study. So you can see the time that I studied has definitely increased quite a lot during exam period. But yeah, it happens.
But I think one thing to also note during that time, I'm guessing there was no lectures during that
Yeah,
time, right?
no lectures. Yeah.
So really and truly, it's almost the same amount that you would have if you were going to uni and sitting on lectures anyway. So you're kind of keeping that same work ethic,
Hmm.
a little bit, let's say, accelerated in some points,
Yeah.
but then you're kind of putting yourself in a position where you're then saying, I'm still going to do 4 to 5 hours a day, which is normal. I think, especially in like
Yeah.
medical schools and dental school, this is pretty much a requirement.
Hmm.
Within that first year, what was kind of the hardest subject? What really caused you pain? And then what's the advice you'd give to any of the students that may be suffering the same thing to overcome that?
The hardest I felt for me, and I don't think all dental schools in the UK actually do this, is um, just learning about the full body physiology.
Ugh,
Because one thing you think of as dentists is you don't really need to know a lot of that. You want to focus more on head and neck. I know I've got friends in Newcastle that didn't go much into full body at all.
right.
Um, so learning about that and kind of mentally telling yourself why that's important, it will really help you. Because at the start of the year, when I got told to learn about all the stomach and everything down there, I was like, why is this relevant to us as a dentist? You later go on to learn about medications and how some things affect the whole body again. So mentally telling yourself, and I highly recommend you, the students, there's a reason why they're teaching you it.
Yeah.
So if you do tell yourself that, you will in the future see why um, why they taught you that, and it's worth it.
Okay. And then, like, struggling with a subject like that maybe you thought was a bit difficult or a bit left field. How do you? I mean, you've kind of told us how you motivate yourself because you say it's important. But how do you then put your mind to it to ensure that you're
Mhm.
passing it? Because sometimes people just don't connect with certain subject
Yeah,
matter, right?
yeah.
So they might just be like, "Well, this is too difficult." What's a good way? So you mentioned Anki flashcards. That's
Mhm.
a really good tip. So flashcards is great. Were there any other revision tips that you use that help you through university generally?
Yeah, yeah. So I one thing I did quite a lot was I emailed the lecturers,
Okay.
and they actually honestly loved replying to it because not a lot of students do email them, and they explain it in so many different ways that one of them should
Mm,
click to you, hopefully. If not, there's YouTube videos. YouTube's got everything you need, honestly, and they explain it in so many different ways there. Sometimes a lot more condensed than your lecturers may have done,
mhm.
which may just help it stick into your mind and help you understand it. And if not that, you have your friends. Everybody thinks differently,
Yes.
and the way I think and I read a piece of text or watch a video and learn it, my friends will do a complete different way. They might have some different methods to remember it, like saying some little silly rhyme to help you
Yeah.
remember some cranial nerves or something. They might have that. So learning from them, learning from YouTube videos, learning from lecturers, try and get as many different people to help you as possible until one clicks. And maybe then you can try and do that yourself afterwards.
I like that. I think it's so true. Not enough people reach out to the lecturers, the professors, and they're actually on hand to help. They actually,
Yeah.
it's so true. They love it, right? They love
Yeah.
helping more on a private level because they're like, oh, this kid actually is interested in my subject. They get really excited about it, and why not, right? I also find that even here abroad, I thought maybe the cultures might be a bit different, but if you do reach out to a professor or you go and see them in person, even
Mm-hmm.
there's so many benefits to it. One, you're going to get a one-to-one, so you're getting more than what you paid for anyway through your tuition fees. You're going to get answers that no one else has, and also you're in their good books for life, right? So in the future, this actually pays dividends. I always find like if people have OSCEs or oral exams and that person is doing it, you're kind of already, a couple of marks ahead, maybe, or subconsciously.
Yeah.
So having that connection and building that network is going to serve you massively moving forward. Being on people's radar in a good light is
Yeah.
well worth it. Really echo what you said there. And the online stuff, YouTube, man, has that saved me so many
Yes.
times. I'm guessing you probably come across like osmosis, right?
Yeah.
It's the fact that everything's so visual, right, and
Mhm.
depicted in a way that you can see everything. It makes microbiology, for example, which I
Yeah.
hated, something that's quite easy to follow because you're just seeing imagery and visual. So anybody who's not familiar with it, yes, take
Yeah.
Nico's advice. Go online, get onto YouTube, find anything as visual as possible. On YouTube, you'll find so many things. And also in your latter years as well, when you start getting into your handwork
Mhm.
online, there's so many videos from Egypt. So I mean,
Okay.
I can kind of really resonate with this part because obviously I was studying in Egypt, but there's so many Egyptian
Oh, yeah.
professors that have so many clinical videos available, right? And
Uh-huh.
it's super helpful when it comes to your handwork. It might be in a different language, but visually you'll be able to follow it along. So kind of
Yeah.
on that note as well, when it comes to the practical side of things with KCL, have you done anything practically yet? And then what
Mhm.
does the future years look like at university for the practical and handwork experience?
Yeah. So in first year, not too much was hands-on, not too much was
Yep.
practical. There's haptic machines that we have used. I'm not sure if you've seen them or not. Not every university has them.
No, I haven't. I'm
But
guessing that's something to do with your hands or something.
haptics, yeah. So basically, you have basically a drill bit in your hand, but it's
Okay.
just a handle. There's no drill attached to it.
Right.
It's a big box, big machine, massive machine. So you sit there as you'd sit on a dental chair with the patient in front of you, and you look through a little screen, and there's nothing on the head. You look through that screen, and you're drilling with different drills. You got a mirror, and it puts pressure on as
Yeah.
if it was something real. So King's has that. A few universities are slowly getting that in the UK. Um, so, so we did that in first year. The
Nice.
older years say it's not completely accurate. I'm yet to experience that. I'm yet to find out, but it was a bit of fun. It was quite nice.
I think we've recently got that. Well, not recently. We've had that in our university, but we
Yeah,
were recently using it here in Slovakia as well. They're like little virtual machines, aren't they? And then
yeah.
you wear the glasses.
Oh no, we have just like a little screen you look down on.
Okay, yeah, so ours are probably a bit older than yours, so we have to wear glasses and then look into the screen, and then
Okay.
it's like a 3D image, and then
Mhm.
obviously
Yeah,
you've got like your mirror in one hand, and then you've
yeah,
got your like little drill bit.
yeah.
They are helpful. I will give you that
Okay.
because we've experienced in mouth already from Egypt, so we've got a bit of a mixed bag of experience. So just for you to know, they do mimic closely enough to
Hmm.
hard tissue of the tooth, and it gives you that perception and understanding of how
Yeah,
much to drill and how careful to be. Right?
yeah.
Obviously, it's never going to be close to the real thing or even phantom heads
Mhm.
in that matter. But because you are able to change the scenario, what your patient might be suffering, you can do so much with those machines. It's well worth it. I would count that as good practical
Okay.
experience. I think fair enough. You might be saying that you haven't really had that in the first year, but you're getting a lot more than so many students, even in the EU, that won't be doing anything until maybe their third or fourth year. So good
Yeah.
on you. What's the second year look like?
Before I jump to second year, in first year we also did some tooth waxing. So with wax, you built some teeth, carving the teeth, and
I
we also
hate that.
prepared some teeth for second year. So real teeth, we put them in a
Right.
mold to put in the phantom heads. So
Amazing,
that's
amazing.
pretty much the
Wow.
practical.
I don't know about you, but wax stuff, nah, man, keep that away from me. That is not for me, right?
Yeah,
So I've done it. I don't want to see that stuff again. Well done to you to getting through that, and yeah,
I think that's
on
all
to
we
the
had to
second
do
year.
though. I think that's finished now. So we've graduated from the wax class,
There you
hopefully.
go. There you go.
Um,
And then before, sorry, one question. With patients, right? Do you guys get that? Because I spoke to someone else from KCL. I think
Mhm.
podcast of that is going live in a couple of weeks. They had the COVID issue, right? The one
they,
that you mentioned
yeah,
at the
yeah,
beginning.
yeah.
So explain the second year practicals, and then actually, if you can,
Yeah.
Tell us about where patients come into this as well.
Yeah. So in second year is when a lot more the actual dentistry as such starts. I already have my timetable for second year, so in around a month's time, I'll be on the phantom heads, doing something. I don't know what yet, but I'll be on the phantom heads, and there's different. You do a little bit of endo, a little bit of perio. There's some cons in second year as well,
Nice.
all on phantom heads. But in second year is when the patients do come into it. At the end of
Wow.
second year, we do see some patients. It's just the basics. I think it's just some scaling, polishing, some BP, just stuff like that. But yeah, in less than a year's time, I would hopefully have had a patient.
Wow.
Um, Majority is obviously year three, four, five.
Yeah.
At year five, you're pretty much just all with patients all the time. But yeah, patients next year, and next year is when people say you'll enjoy dental school a lot more because it's a lot more in person. You actually get to feel like you're doing dentistry. You get to see your cohort a little bit more, and you enjoy it. It gets harder, but you enjoy it, and it's quite nice. I've heard.
That's amazing. I mean, doing that in your second year is mind blowing. I think this is why KCL is KCL, right? And it's renowned around the world because they put their students through their paces quite early on, and it's good to see that. I mean, I had to wait 3 years before I was even looking at a patient. The fact that you'll be doing, you're probably going to be doing standard checkups as well, understanding what real patients look like in the chair, what intraorally, how things look, extraorally, what to check for, which is very important as a dentist. For you to get that experience in your second year is amazing. I think for anybody listening who's either about to start their KCL journey or their dental school journey within the UK or abroad, it's going to follow a similar suit, right? They're going to be in there the first year, and you might feel a bit disheartened because you might feel like, well, where's the dentistry? And this isn't what I really was expecting, right? But just hold fast, get through that first year, and you'll see the fun starting from the second year onwards. And that's nice to hear that you're doing things like endo as well, which for some unis they ain't going to start until their fourth year. 6-year courses sometimes they start that in the fourth year. So really getting some good experience there. I think from that point, then you kind of wrapping it up. What does the future look like for you? Have you figured out already what kind of specialism that you want to go into? Is it general dentistry you're after? Other than just graduating, which is step one, what's the future look like for Nikhil?
The future, very good question. I wish I knew the answer myself. No, I'm at a stage right now where I just want to experience as much in dentistry, in the dental space as possible. So whether that be clinical dentistry or some businesses around dentistry, general dentistry, some specialization, learning about other technologies that are used in the dental space. So one thing I know, AI is coming up quite a lot now. So I want to get a little touch on that. I don't know where I want to be just yet, but I want to have a little taste of everything and then choose what I feel sits right and sits best with me. So I'm completely open right now, but I'm at a learning stage. I want to learn as much as possible from as many people as possible, just to be able to experience all that this career's got to offer, because this career is a great career with so many different aspects to it. A lot of people just go to dental school, graduate, and practice only dentistry. There's a lot more than that. But some people leave dentistry completely, which is also understandable. So we'll see what the future holds. But yeah.
I think what we'll do is just for the sake of everyone, we'll do like a catch up maybe at the end of each term, and do another little podcast and see how you're getting on. And you can be our eyes on the inside for UK universities and KCL, especially, of what it's like, what it's like to actually be there, what you've done, what your notes looking like. We can post these kind of things and help people out. If anybody wanted to get in touch with you, how could they do that if they wanted any advice or just wanted to learn more?
Yes. So I'll ask Naveed to put my Instagram and my LinkedIn somewhere, either on here or in the bio or something. I don't know what.
I'll do that.
My Instagram, LinkedIn will be there. So please get in touch with me wherever you want, wherever you can, whether it be help applying to dentistry, being in dental school, or anything in general. Please feel free to get in touch. I'm happy to help. I'm happy to reply, and I look forward to whoever gets in contact with me as well.
Amazing stuff. So there you have it, guys. I think if I've sat here for the past half an hour learning so much about UK universities, what to expect, and what the future looks like for a lot of you guys that are going to be taking that journey this year and in the coming years. I hope you also learn. Sorry, say that again.
Good luck to everyone who's
exactly.
School,
Good luck to everyone. And genuinely, if you do need to reach out to either myself or Nikhil, our details will be in the description box below, as always. And I'll probably put it up somewhere in the screen as well. It's been an absolute pleasure, Nikhil. Thank you so much for being a part of this today. And as I said, we will catch up with you in the near future. And for everyone else who is listening, we'll see you on the next one. Take care. Goodbye.
Thank you. Thanks, everyone.